In this video, we're going to look at some exercises to help with jaw or TMJ pain. TMJ stands for the temporomandibular joint, which is your jaw joint, and you have two of these, one on either side of your jaw. The phrase TMJ is sometimes used just to describe the problem, so you may be diagnosed with TMJ syndrome, or people just talk about TMJ pain. Pain is one of the symptoms that people suffer from, but they also can have problems with opening and closing their mouth, popping and clicking as they open their mouth or they chew. And for a lot of people, they also suffer from bruxism, which is tooth grinding at night in particular, or tooth clenching. And so for these people, they quite often will be given a dental splint, which helps to protect their teeth at night. And the reason that TMJ may be worse at night, or bruxism may be worse at night, is because we don't have conscious control over the muscles when we're asleep. For many people, the problems that they are suffering from are actually caused by tension in the muscles and the fascia around the face, neck and jaw. So your jaw is controlled by a number of muscles, and in particular two muscles of chewing. And you have two sets of these, one on either side. The first one is called the temporalis muscle, which is a fan-shaped muscle that sits at your temples, and the tendon comes down and attaches into your jawbone. The second muscle is the one that we're going to be working with today, and it's called the masseter muscle. For its size, the masseter is the strongest muscle in the body, and it's multi-layered, which means it's quite thick, and there are layers of muscle fibres and fascia throughout the muscle. You can certainly feel the strength when you clench your jaw, but to do these exercises, you need to have your jaw relaxed. So use clenching your jaw just as a way of finding the masseter. But then when you do the exercises, keep your jaw relaxed with your mouth just slightly open. So the first exercise we're going to do is working on the outside of the masseter. And to do this, we're going to use our finger pads and just place them just below your cheekbone, actually on the masseter muscle. So allow your finger pads just to start to sink into your skin. As you do this, imagine that they're sinking through and making contact with the muscle fibres and the fascia of the masseter beneath. So the more you imagine this, the more your body will respond by letting go. So once you feel you've actually got some contact with the muscle and the tissues below, then very slowly start to drag traction your finger pads down the line of the muscle. The slower you do this, the better, because you will feel what's going on. And when you reach a point that feels tight or sore, then just wait on that point until it starts to release or ease. This is a trigger point or a fascial restriction, which can be some of the cause of pain and other problems. So just allow your finger pads to continue slowly down until you reach the bottom of the jawbone. So to do this exercise at home can take 2 to 5 minutes. And it depends on how many tender points you feel on the way down. And you can do this exercise 2 or 3 times a day to help release your masseter muscle. So the next exercise we're going to do is working on the inside of the mouth to access the masseter muscle. So remembering that the muscle runs in a line down from the cheekbone to the jawbone, it's possible to work with your thumb inside your mouth and your fingers on the outside to access the muscle. So to do this, you use the hand on the opposite side to where you want to work. So if you're going to work on your right, you use your left hand, or if you're going to work on your left, you use your right hand. So sliding your thumb into your mouth between your teeth and your cheek.
Slide your thumb back as far as it will go until you hit what feels like bone. This is the masseter, and if you clench it, you'll feel it tighten so you know where to work. With your thumb on the inside and your fingers on the outside, compress the muscle between the two and wait for things to start to release. Things may feel tender at first, but as long as you're there for 90 seconds to 2 minutes, things will start to soften. And then you can continue to work further down the muscle, doing the same thing, working on any tender spots that you find.
So the next exercise we're going to do is a stretch for the front of the chest and the throat, coming up into the jaw, because a lot of people have tension here, which can affect the movement of the jaw and sometimes even cause pain coming up into the jaw joint or the ear. So to work on this area, it's best if you can wear a top so that you can actually place your hands directly on the skin. So we're going to cross the hands on the skin just below your collarbones. And just allow time for the palms of your hands to sink into the skin, imagining that you're making contact with the muscles and the fascia that are directly below the skin. Once you feel you have that sense of contact, then let your arms go heavy so that you're creating a slight downward pull towards the floor. So you're not forcing this, you're not pulling, you're just allowing the weight of your arms to create that stretch. So for some people this may be enough of a stretch that they feel in their throat. But to increase the stretch slightly, you can just tip your head back. Be mindful not to go too far back so that you feel dizzy, but just enough to feel a stretch coming up into your throat and the underside of your jaw. And you can be here for 90 seconds to 2 minutes to allow the fascia to start to release. And as it releases, you can turn your head slowly to the side, and you'll feel a stretch coming up the side of your neck, into your jaw and even into your ear. And you can then turn your head to the other side to stretch here. While you're doing this, make sure that you keep your jaw nice and relaxed. And just allow time for things to start to release and let go. For many people, the TMJ or jaw pain can be caused in part by stress. And in fact, they tend to find that the more stressed they are, the more they clench or grind their teeth, and or the more pain they have in their jaw. So when we're doing exercises to help release the jaw, it's a good idea to do a general relaxation exercise. And so that's what we're going to do, using 2 myofascial balls in a bag. So I place the balls under my neck and just allow my body to relax around the balls. When you do this at home, you can do it lying on the floor as I am. You can have your knees bent, you can have your legs flat, whichever is more comfortable for you, or you can do this on your bed if it's too uncomfortable to be on the floor. As the tissues start to relax in the back of my neck, this is going to start to release the base of the skull. And at the base of my skull are a lot of muscles and tissues that attach in from my neck, my jaw, and my shoulders. So the more this area relaxes, the more it starts to take tension away from my jaw. It's also a very nice relaxation exercise to do because it helps to engage the rest and digest part of my nervous system. and that helps my whole body and my mind to relax. When you do this exercise, you can be here anywhere from a couple of minutes to 5 minutes or even longer, depending on how it feels. So these exercises can help to release the muscles and the fascia around your neck and your jaw and start to undo some of the tensions that are causing your current symptoms. You can find more exercises like these in our Living Pain Free online video program, which is available through our website, and where you'll also find our myofascial release kit.